Hi everyone, I'm Dr. Jasmine Just from QUIT. Welcome to this short webinar explaining the RACGP accredited Plan, Do, Study, Act cycle for smoking cessation. The Pdsa is designed to help you embed best practice smoking cessation treatment as part of your routine care of patients. So today I'll be answering some of your key questions about completing the Pdsa, and hopefully by the end you decide it's something you'd like to do in your clinic. Today I'll be answering some of your key questions about completing the Pdsa cycle. So I'll be answering what actually is a Plan, Do, Study, Act cycle, what is the Pdsa cycle for smoking cessation, what is brief advice, how many CPD points will you receive, how long will it take you to complete the Pdsa, how do you register for it, how do you successfully complete it, how do you download your certificate, and finally, where can you go for more help or information if you need it. What actually is a Pdsa cycle? So Pdsa cycles are designed really to help you improve the quality of care that you and your clinic provide to your patients. So the Pdsa method is designed to help you implement a particular change in your practice by breaking down the process into smaller, more manageable parts. And then each part is tested to ensure that there's ongoing improvement. So individual GPs or the entire practice team can actually undertake Pdsa cycles, and generally they're aimed at either improving practice by changing or evaluating your current systems and processes, or they're aimed at improving individual clinical skills and knowledge. So you can read more about Pdsa cycles in the RACGP handbook. The link's provided on your screen. The Plan, Do, Study, Act cycle for smoking cessation has been developed by QUIT in collaboration with Gippsland Primary Health Network and with input from health professionals like GPs. So it consists of 4 cycles. Each cycle has a plan, do, study, act component, and each cycle is designed to help you and your practice team to embed best practice smoking cessation activity as part of routine care. I'd like to give you a brief overview of what each of the 4 cycles is going to involve. So cycle 1, so that's all about having a look at the new and emerging literature on tobacco and smoking cessation. In cycle 1, you'll also be prompted to complete QUIT's brief advice for smoking cessation online training course for GPs. So for some GPs in the Gippsland region, you may have already completed QUIT's face-to-face brief advice training. If that's the case, you can go straight into completing the Pdsa. For everyone else, we'd strongly advise you to complete the brief advice online training first. Cycle 2, so that's all about having a look at your patient data on your medical software systems and having a look at the smoking status that's been recorded. You'll be prompted to set some red flag reminders for smokers and any patients with an unknown status recorded. Cycle 3 is all about having a look at your practice environment to ensure it's conducive to patients making QUIT attempts. So that might include making sure you've got adequate systems in place. For example, have you got QUIT line referral forms embedded in your medical software? And do you have waiting room resources available for your patients who'd like to quit? Cycle 4 is all about implementing QUIT's 3-step brief advice model on 20 current smokers. So I'll go through that model in a little bit more detail shortly. So within each of the 4 cycles, there is a plan, do, study, act component. So I'd just like to give you an example of what that actually means. And let's use cycle 1 as an example here. So I mentioned that cycle 1's all about having a look at the literature and making sure that you've done QUIT's brief advice training, whether that's online or face-to-face. So the plan component of that cycle is basically making a plan to do that. Do is actually reviewing the literature. QUIT has provided the links for you to do that and to complete the brief advice training as required. Study is really prompting you to reflect on the things that you've read and anything that surprised you. And ACT is about identifying some strategies that you could put in place in your practice to help you address smoking amongst your patient population and make sure that that's happening in a systematic way. So I'll cover this in a little bit more detail shortly. Brief advice is probably a term you're familiar with, but I'd just like to take a moment to talk you through brief advice for smoking cessation and the 3 steps. So QUIT, in consultation with GPs, has developed this 3-step model of brief advice with the key steps of ask, advise, and help. So it's also known as the AAH model. And really, it's a condensed version of the RACGP 5A's approach to smoking cessation. And it's all about having a conversation about smoking that is fast, simple, and effective. So the 3 steps are ask. So ask all patients about their smoking status and document this in their medical record. Advise all smokers that the best thing they can do for their health is to quit, and that the most effective way to quit is with a combination of pharmacotherapy and behavioural intervention, such as referral to Quitline. It's at this advice step where it can help to really tailor the advice to your patient's particular situation. So, for example, if they've come in for a review of a surgical wound, you can advise them that quitting smoking can actually help improve wound healing. So, yeah, tailoring to their situation can help make the message stick. And thirdly, help. So, this is all about prescribing nicotine replacement therapy or smoking cessation medications and referring patients onto Quitline. The Pdsa cycle for smoking cessation has been accredited by the RACGP, and completion of it means you'll receive 40 Category 1 CPD points. Completion of the Pdsa cycle for smoking cessation is self-paced, and it's really designed to be completed over a period of about 15 weeks. The good news is that you can log in and out of the course as often as you need to resume at a time that suits you. As you work through each of the 4 cycles, there will be suggested timelines for when you might expect to complete each cycle. So cycle 1, for example, that might take you about a week. Cycle 2 is a bit more involved, so you could allocate about 6 to 8 weeks for completion of that. How do you actually register for the Pdsa? So it's pretty self-explanatory. So you can visit the URL that's on your screen at the moment. So that's education.quit.org.au. From there, there'll be a tab on the bottom left-hand side of the page entitled Online Training for Health Professionals. So once you've clicked on that, what happens next depends on whether you're a first-time user or not. So if you are a first-time user, you'll be prompted to register your details in the registration form. If you already have an account, which might be the case if you've already completed QUIT's brief advice training for GPs, you can simply log in with your existing username and password. At the end of the webinar, we've actually provided a demonstration of what your screen will actually look like. Once you've registered, you can click on the Pdsa Cycle for General Practitioners course link that will appear on your learner dashboard. You then simply work through the topics as they're presented to you in the contents menu, which appears on the left-hand side of the page, and it starts with About this course. Then you simply work through the steps. So that's completing the pre-PDSA questionnaire activity, followed by the registration. So this is going to ask you for some more details about your practice and you as an individual participant. You then work through each of the 4 cycles and the activities within each. And finally, you complete the post-PDSA questionnaire activity. Again, we've provided a demonstration at the end of this webinar of what this will actually look like on your screen. The important bit, how do you download your certificate? So again, pretty straightforward. You simply click on the dashboard link that appears on the top right-hand side of your course page. This will take you to your learner dashboard. So then your certificate should appear as a downloadable link under the completed courses tab on the right-hand side of the page. So you can click on that course link and view and download your certificate. So that's just for your records. You don't actually need to do anything else to get your points. QUIT will actually forward your certificate to the RACGP and your points will then be allocated. Again, we've got another demonstration at the end of the webinar if you'd like to see what that will look like. Hopefully this webinar has answered some of your key questions about completing the PDSA cycle for smoking cessation. If you do need more help or information, you can contact us. So you can visit the education.quit.org.au website. You can also contact us via phone on the numbers listed there, or you can email us at quit.healthprofessionals@cancervic.org.au. Thank you so much for joining us today. Hopefully that's been useful. That concludes the end of this webinar.